What I'd like to go over today is how to complete a CMS 1500 form for somebody who has Tricare insurance. Just as we have with other insurance forms, we're going to start at the top with the carrier information. This is where we would put in the name for Tricare and then the address to where we're going to send the claims. For this particular claim, we're going to be sending it to P.O. Box 870140. And this is located in Surfside Beach, South Carolina, and the zip code is 29587. As with all of our forms, we're going to start with box or item number 1. In this, we're going to head and mark that we have a Tricare claim. When we have a Tricare claim, we need to put in the sponsor's ID number, and then we go ahead and we put in the patient's name. And if the patient and the insured are the same, we can leave item 2 blank. In this case, we have one of the sponsor's dependents. Then we put in the patient's date of birth, which is January 14th of 1975. This is a female. Now we're going to put in the sponsor's name here in the insured's name. And then we're going to go ahead and put in the patient's address. Now this is where a Tricare claim is different from some other claims. If the insured and the patient are the same, then we go ahead and just fill out all that information in box 7. For a Tricare claim, we actually fill out box 5 with the address here. I think I put a 0. There we go. That's better. And the zip code. And we leave the telephone blank. This is the insured's or sponsor's spouse. And over here on the address, we just listed as same. Box 8 is left blank. Box 9 is left blank. And then we answer the questions in box 10. With a Tricare claim, we do not have to put in the insured's policy group number. We do not have to put in the insured's date of birth. And all we have to do is answer question number 11D, which is there another health benefit plan? And we answer no. The only other thing that we need to do is we need to signify that there is a signature on file for item number 12, which authorizes the release of medical records to Tricare in case they should need those in order to adjudicate the claim. Now let's go ahead on down to the form. This is really the biggest difference with the Tricare claim versus the other claims that we have been doing. Now let's look at item numbers 14 through 33. Item number 14 is the date of current illness. With Tricare, we can, if we know that information, we can go ahead and put it in. If not, we leave it blank. Item number 15 can be left blank. Item number 16 is more for workers' compensation, so we can leave that blank as well. Item number 17 is the name of the referring provider or other source. If there is a referring physician, we would go ahead and put that name of the physician there and would fill in their NPI number here at item number 17B. If we are looking at a form because the patient was in the hospital, we would fill out item number 18 here. 19 is left blank. Is there any outside lab for item number 20? And there is not. Then we put our diagnoses in here. The patient's diagnoses is I-10, which is essential hypertension. And the other diagnosis we have is an I-49.01, which indicates that the patient has atrial fib. Then we come down to item number 22, which is the resubmission code. Item number 23 is the prior authorization number. If we had to have anything that had prior authorization, we would fill this out as well. Item number 24 is the date of service, which happens to be October 6th, and we put in a 4-digit year here. Whoops, or 2-digit. This is all my forms let me do. Place of service, which it would be in the office, and then what we saw the patient for. This is a level 2 established patient office visit, and why the patient was seen, and the total of our charges, how many units, and then the physician's NPI number. We also had another charge that day as well. They did an EKG on this patient. We did a routine EKG, so that is a 93,000. We have to indicate why we did this particular claim, and we did it because they have hypertension and because of the atrial fib. The charge for this is $70. We did it once, and then we need to simply put in the physician's NPI number here. Item number 25 is the federal tax ID number, and we're going to go ahead and put in the clinic's NPI number here. Indicate that is their EIN number. Patient's account number is optional. Item number 27 is, do we accept assignment? We fill that out. We go ahead and we put in the total charges, how much was paid. If the place of service is somewhere other than the provider's office, then we would need to fill in item number 32 and item 32A. But since the patient was seen in the office, we simply just need to put in the 10-digit telephone number. And the name of the facility where the patient was seen. And we're going to go ahead and put in their address here. Let's see, 841 Orchard Road in Columbus, Ohio. And the zip code, and then the NPI for the clinic. And that is how we complete a CMS 1500 form for a patient who has Tricare insurance.